Mental health. Yes, that is what we are going to talk about today. And before you just scroll up or just slide away, let me tell you, I know you are fed up of all those posts, reels, videos related to this very topic and how overused or cliche mental health has become. But trust me, this video will be worth it. So, what we are going to talk about today is stigma related to psychotherapy in India. Now, when we talk about giving treatment to a mental ill patient, there are basically two things. One is the medication that is provided to them, and second is the therapy or the counseling sessions provided to them. That therapy is known as psychotherapy. Basically, both these steps go hand in hand. So, we are going to talk about all the stigmas related to this particular psychotherapy in our country, India. But wait, I'm no professional. That is why today I invited Dr. Tejal Kothari, a psychiatrist who is actually into this field, to give us proper insight on the topic. Well, she has a lot to give and we have a lot to learn. So let's go.
Okay, so I am a psychiatrist. I have done my MBBS and then I've done my post-graduation in psychiatry. And I'm currently working in a Delhi government hospital as a psychiatrist. And I think that's it.
What do you think is the main or root cause of this ingrained stigma towards psychotherapy in India?
Okay, so see, stigma for anything, the main cause is always lack of knowledge about it. Okay, so that's why how people in India today lack, there's big lack of knowledge regarding mental health, mental illness, awareness and everything. Okay, it is improving, it is definitely improving, but it's not as good as it should be. So this stigma is because of this lack of knowledge. There are a lot of superstitions and very wrong kind of thinking that comes up for these disorders, because most people don't understand these mental illnesses at all. And then the fact that they are so difficult to understand and the general public doesn't understand it, so they come up with new and new rumors about the illness. And that's how the stigma forms. There is, in fact, I would say mental illness ke against there's stigma all over the world. But I think it's more in India because probably somewhere we don't understand the illness at all. People are not willing to come up for treatment so easily because they feel that this illness is going to, it is going to hamper them for the rest of their lives. They have many wrong notions regarding mental illness.
Definitely, I also believe so, and I've seen so many people around me, even I would say my parents, who are still stigmatized. They believe in things and they try to impose it on me. So this it is not very easy to change. When I talk about people stigmatizing mental health, there are different sections. Some are highly against it, some are on the average, and some are trying to change their perspective and enter into a new world, but they still have their doubts. So do you think they are really capable to change this attitude of theirs?
Yes, I really feel that the stigma is going to change only at a very individual level. Like when youth especially, and because that's why I'm really happy to connect with people like you who at such a young age understand the fact, that there is something called mental health, there's something called mental illness. If these are the problems you're facing, you may be having depression, so you need to see a psychiatrist, psychologist. जो भी आपको ये सब चीजों की knowledge अब youth को होने लगी है जो पहले नहीं. So yes, I think each and every individual is important here. Because ये जो stigma शुरू हुआ था, that was also from word of mouth, and I think जो stigma खत्म होगा, that will also come from word of mouth. And people start going for therapies, they start meeting, and they come back and say, "Oh, I felt so good because I have a psychologist, or I've been taking these medications, and I'm feeling so much better." So that is how it's going to help.
Is there any particular false belief that you have heard the most that really irritates you?
But there are lots and lots and lots of false beliefs. I don't know where to start. But if I tell you about simple, small things, like for example, because I'm a doctor, I deal more with medications. We do therapy as well, but always for any mental illness, medications are the first stand. So I hear so much of stigma against medicines of psychiatry. They're addictive. They're just sleeping medicines. You're going to take them for the rest of their lives. So आपका दिमाग खराब कर देंगे. Nonsense like that. And I'll just give you a simple example. Antidepressants that लोग बहुत खराब बोलते हैं about antidepressants. They are this and they will spoil. The thing is, antidepressants are the only drugs that are known to increase the neuronal density in your brain. So the neurons that have actually died because of the toxic effects of depression, antidepressants actually help to regenerate those neurons. So in no sense are they bad drugs or drugs that are going to affect you, and they're not addictive at all. They're not addictive at all. But of course, like a lot of drugs, they need to be reduced very slowly. We cannot stop them immediately. So that kind of thing happens.
Definitely. And when you told about medications, this thing is put into our mind because every movie we see, people eat their antidepressants or whatever medications, and they, get addicted. And they are shown in such a way that we are made to believe ki no, this is what actually happens. But whereas it doesn't. So, media and movies and everything play a big role.
Absolutely. Your media, actually, your movies unfortunately have really made psychiatry and mind sound like something is very evil. Medications are very evil. So that has to change. And I think a lot of changes can come up. Like, for example, simple things like Tare Zameen Pe. They showed a dyslexic child. So people started accepting dyslexia, like it's something that is not acceptable at all. They started understanding that my child might be having this. So there is a need to have positive movies that talk sense about mental illness, movies that have, at least Indian movies that have some research being done on it. Unfortunately, R&D Indian movies में बहुत कम होता है, especially regarding when it comes to illness and medical field. So they just say anything and anything that comes into their mind. So yes, I think if we have more movies, we have more media covering mental health, we have people like you talking about it, whether it be social media, whether it be anything. So all that is going to help.
What do you think is the current trend or pattern of this social stigmatization? Like, where, as a country, where do we stand right now?
As a country, I think we are progressing when it comes to reducing the stigma. We are getting better. But you must know that India is it used to be 2-3 years back, India was a suicide capital of the world. So there was a huge dearth of people committed. There was a huge group of people in India that have committed suicide and are continuously committing suicide. So it's one of the saddest. India is considered one of the saddest countries if you see the happiness index or whatever they create. So we still have a long way to go, because I think we have just started our journey towards mental illness. We started understanding what mental illness is. We started becoming more positive. We have increased the number, for example, the number of psychology seats, the number of psychiatry seats are increasing overall, even in hospitals and in colleges. So I think we have started to understand, and the fact that people have started taking therapy very seriously. A lot of people have started taking therapy. I see a lot of young people going for therapy, which is a great thing to do. So I think we are moving, we are progressing, but we still have a very long way to go.
Now moving on to some personal questions that I would like you to answer from the perspective of a professional who has been into this field. So my first question, and a question that everybody wonders about, is being a psychiatrist in India, what are the main problems you tend to face?
First and foremost, I think as a branch, the moment you take it, people are, they're like, ye kyun le liya? Why did you take psychiatry? So that is one thing. The branch itself is stigmatized lesser now, but yes, it is still, there is a stigma related to psychiatry. And secondly, in terms of psychiatry, we have lesser number of people coming to us immediately. So for example, a person who's having, say, random pains and aches and is actually going through depression, they're going to go through many other medical specialists, they'll go through surgeons, they'll go through many other specialities and finally come to psychiatry. So patients coming to us, they take a much longer route, and sometimes they come to us after everything has been done and messed up.
Is there any social or economic barriers you face being in this field?
A social barrier, again, like I said, because there's a generalized stigma regarding psychiatry, there are social barriers like, calling psychiatrist paglo ke doctor. And it's said this is a part of social barrier. If you don't have this kind of thinking, it will be much easier for people to approach you. So this is, yes, a social barrier that I feel, that the stigma associated with mental illness, not taking treatment, that's a part of social barrier. Economic, not so much. If you're looking at government setups, in our government setups, actually a lot of people don't know this, but government hospitals have very good psychiatry departments, that they have free medications and free treatment and very good doctors. So economically, in fact, I feel that India is doing pretty well compared to others, because we have a lot of doctors who are also working for people, working in NGOs and working in government setups. So in that sense, economic barriers are, I think, a little less. But yes, problem with psychiatry is the medications can go on for a while. So like 5 or 6 months, you might need to invest in medicines. You might need to take those medications. So yes, some people might face this economic issue, might face that they have difficulty in buying those medicines. But as of now, I don't feel economic so much as social. If you're a part of that community who's fighting against the stigma, I think it's a great job done, because aaj ke zamane mein we really need more students, more people to understand it.